Hello, once Pathak and you're watching my channel. So today I will talk about linen and laundry and part one of the linen and laundry chapter. So this is the chapter for the hospital management, and I hope you really like this video. Please don't forget to like, share, subscribe my channel. Also, you can follow my Instagram account, which is Healthcare for You Forever. So let's get started with this particular presentation. So, what is basically linen? Linen is made up of fiber, and this may be of cotton, nylon, and wool. Fabrics are used in great variety of ways throughout the establishment, like hospitals, and may be chosen for their decorative value, their comfort, warmth, or coolness, their protective qualities, durability, and even for hygiene reasons. Okay, so there are some qualities that very much required for the linen to be there in the hospital. If these qualities are not proper, then the linen has to be changed or it has to be discarded. Now, the specific qualities of the linen are as follows: proper moisture, proper dry efficiency, proper surface fluff, proper strength, and low flammability. Static electricity safety of the linen is also really very important. Any changes in the linen quality should be changed immediately. The linen should be changed immediately if there are any changes in the linen quality, if there's no proper moisture, no dry efficiency, no surface fluff, no proper strength, no flammability, then um, you should then change the linen. Now comes the linen structure. So there's a structure of linen, and it's a crisscross structure as you can see on the slide. In weaving, there are two sets of thread. The loom is set up or strung with long vertical threads called warp, and crossing or interlacing threads is the weft. So as you can see in the structure, there's a crisscross structure, and as you can see, the vertical strands are known as warp, and the horizontal strands are known as weft. I hope you have understood this particular structure. So let's move on to the next slide. Linen requirements. Okay, so in the USA, six complete sets of linen per bed are required based on 100% hospital occupancy and 40 hours of laundry per week. One set on the patient's bed, one set en route to laundry, one set being processed in the laundry, one set is ready for use, and two sets in ward store for use in case of emergencies. So this was the requirements of the linen in the USA, okay, in the hospitals of the USA. But the actual requirement of the linen for the operation theater depends upon the following factors, and it varies from country to country. So the requirement of linen depends on following factors: number of operations per day, type of surgical operations, number of operation theater personnel, working hours of the operation theaters, then number of operation theaters, number of emergency operations. Individual variation, laundry facilities available, quality of linen supply, expected increase of workload. So the first six factors you can see are the main factors for the actual requirement of the linen, and the last three factors are the individual variation. It depends, like uh, the requirement of the linen depends on different laundry facilities available, quality of linen supply, and expected increase of workload. Okay, let's move on to the next slide. Categories of linen. So there are like four categories of linen, and in the slide there are two categories. So one is soil linen. This is the used linen which has to be cleaned before reuse to avoid hospital infections. It has been suggested that sorting of soil linen should be done in a ward or operation theater area. It must be immediately placed in washable bags and sent to the laundry as soon as possible. Proper labeling or marking of the linen has also been suggested. So soil linen is like the dirty linen. It doesn't have so much of contamination, but it is still dirty. So it has to be cleaned before reuse. So that's why it is, kept in separate bags, and then it is labeled properly so that it does not get mixed with the clean linen or sterilized linen. Okay. Now comes the infected linen. This is the linen which is infected totally, and it is used by infected patients. It has been suggested that infected linen should be removed from the patient care area immediately. It should immediately be kept in waterproof containers and sent to the central disinfection area, where the linen will be put into an appropriate washing machine. So this is an infected linen. So infected linen basically means that it has some, microbes or bacteria or germs which has been transferred from the patient to the linen. Okay, so like the obviously the patient who is there in the bed, is there on the bed and it's using the linen all the time. So obviously that patient must be having so many of germs, microbes, bacteria, dirty, hands or dirty legs. Okay, so what happens is the linen gets infected. So when the linen gets infected, it needs to be separated so that no infection is caused to other patient or to the other paramedical or medical staff, and that's why it is kept in the waterproof containers and then sent to the central disinfection area so that it can be put into appropriate washing machine. Now the next two categories of linen are foul linen and infected and foul linen. This type of linen contains feces and excretion. If the patient, you know, does some excretion, then the linen becomes very foul. And in the past, nursing orderlies or sweepers did sluicing. After sluicing, this linen was sent to the laundry for washing. And nowadays, this type of linen is collected from the patient care area in the waterproof container, sent to central sluicing plant, from where after sluicing the linen, it is sent to laundry for washing. Okay, so this is a foul linen where the excretion is done by the patient and the linen becomes foul. Now it's smelling. It is giving a lot of smell, and it also is very harmful to the paramedical and medical staff and as well as to other patients. Then comes the infected and foul linen. This category of linen is the most dangerous type of linen from the hospital infection point of view, as it contains infected excreta with infected blood. These types of linen should be immediately removed from the patient carriers in waterproof containers. After securely closing the neck of the containers, it should be taken to a central disinfection area where the proper disinfection should be done before washing. So this is the most dangerous linen because it contains excreta. Sometimes it can also contain excreta with infected blood. So that's why it is the most dangerous one. It can cause a lot of infection in the hospital. Okay. Now comes the last topic of this particular presentation, which is the autoclaving of the linen. That is, there are two types of systems for the autoclaving. In this system, sheets, towels, and other linen articles are returned from the laundry after washing to central sterile supply room, where they are inspected, folded, and wrapped in muslin covers or packed in metal drums and sterilized. After sterilization, these drums are sent to operation theater for the use during the operations. Okay, so this is centralized one. Okay, and the decentralized one is in the system. The operation theaters, delivery rooms, and other areas of the hospital have their own linen, which they send to central sterile room for sterilization. If operating department has its own TSSU, which is theater supply unit, this linen is sterilized there itself. So there's a difference between centralized and decentralized. Okay. Okay. So this is the difference between centralized system and decentralized system. So these are the two systems of the autoclaving of linen, and the sterilization of the linen supplied to the operation theaters is must to avoid the infection during the operation. And all the big hospitals are advised to have their own central sterilization service department called theater sterile supply unit within the operating department. So this is the difference between sterilized system and decentralized system. As you can see, that in the first one, that all the sheets, towels, and linen articles are collected. Okay, they are returned from laundry after washing to the central sterile supply room, and after they get inspected, folded, wrapped in muslin covers, packed in metal drums and sterilized, then they are sent to different operation theaters or delivery rooms and everything. When it comes to the decentralized system, they have their own linen and they are being sent to the central sterile system room for sterilization. And if the operating department has its own TSSU, which is theater sterile supply unit, then the linen is sterilized there itself. Okay, so this was all about the first part of the linen and laundry chapter. I hope you will like this video. Please don't forget to like, share, subscribe. Thank you so much and stay safe and healthy. Bye bye.